Hello, this is Dr. Taiwo Durowade from Dardur Gynecology, and I'm about to interview one of my patients about her results with testosterone pellet therapy. Join me. All right, how you doing, Delania?
Wonderful. How are you?
I'm good, thank you. Thank you. I wanted to ask you, how did you find me?
I found you through my aunt. She highly recommended you, and I told her that I was having issues with night sweats and hot flashes, and then I was having trouble sleeping. So she highly recommended you, and she told me that I should go in for a consultation and appointment with you, and I've been with you ever since.
Awesome, awesome. So you mentioned night sweats, you couldn't sleep, hot flashes. What about any other issues like mood symptoms, feeling down, feeling anxious?
Yes, prior to having a first appointment, an initial appointment with you in consultation, I was suffering from sleeplessness, and that led to me having mood swings. I wasn't sure what was wrong with me due to the sleeplessness. I even had thoughts of suicide. I was hospitalized for 4 days
Oh
because
my
I
God.
wasn't sure um, what was going on with me. So I was having some issues with anxiety and depression as well. So yes.
Well, thank you for sharing that, Delania. And then I know that we usually at your consultation, we draw blood, try to figure out what if it's a hormone problem. And then we figured out it was testosterone was low. We figured out your testosterone was low. So how would you say the procedure went? How would you say the pellet procedure was?
I can say that I've had numerous women ask me about the hormonal replacement therapy. I've even had a couple of women who have gotten your information
Mm.
because they were very interested in finding out more and very interested in receiving the replacement therapy themselves. So I will say that with the procedure, and they always ask me, well, how's the procedure? What does she do? And what do they do? And I'm like, well, it feels like a very small pinch. You can't
Mm.
really feel it. And the pellet is inserted in your hip, looks more of like your buttocks, but it's inserted in your hip. And you just have to make sure that within 24 hours you do not shower or anything like that, because you don't want the very small incision. It's not anything. It's no like surgical procedure or anything. It's
Mhm.
just a very small, very minuscule incision. And once you get it in, you can't even tell that it's in there. So yeah.
Awesome. Awesome. I'm really glad that that was your experience.
Yes,
And
yes.
when would you say you started noticing results? When would you say you started feeling better?
I started noticing results probably after like maybe 3 to 5 days. I started
Mm.
noticing a difference with my sleeping habits, and I wasn't having. It was almost like miraculous. It was like 40, 40. I would say 40 within 48 to 72 hours. I
Wow.
wasn't having any, because I was having issues with hot flashes. I was probably having hot flashes like every 10 to 15 minutes.
Oh my
And I
God.
noticed like within 48 to 72 hours, I wasn't having any, like my hot flashes were slowly but surely minimizing. I would say by the third or fourth day, I wasn't having any hot flashes. I noticed like during the time I was sleeping, I wasn't having any night sweats or anything like that. So it was, I would say, to be honest with you, I saw an immediate difference in
Oh,
how my body was reacting prior to receiving the pellet.
I'm so glad to hear that. I'm so glad to hear that. And how would you say it helped your mood?
You know what? To be honest with you, I think that one of the biggest reasons why I was experiencing those mood swings was because of lack of sleep.
Mm.
So once I received the pellet and I started getting sleep, and just like I stated before, it was like within 48 to 72 hours, I was really feeling like a new woman. I'm not having issues with night sweats. I'm not having issues with hot flashes. I've been able to sleep these last 2-3 days. So my mood is much better than what it was a week ago. And I mean, it was to me, it felt miraculous. It really did. It felt miraculous.
I'm so glad. I'm so glad to hear. And yeah, my question was, would you advise women to get it? And it sounds like you already have. So thank you for that.
Definitely. Most definitely. Like every woman that I know that's going through these experiences, it doesn't matter how old they are. I have a sister, I have one sister, and she's 44, and she's starting to experience just a little bit of the symptoms. And I told her, I said, to be honest with you, the hormone replacement therapy is something that you should really consider once those symptoms start coming and you see the consistency of them. And I encourage all of my friends who are, in their 50s and, even friends that I have and that's even older than their 50s, that's past menopause, I encourage them as well to consider the pellet because, and I highly recommend it, especially due to the fact that we don't really, what I'm learning is that once we become middle age, we really don't discuss what's going on with our bodies. Like we'll talk about our menstrual cycles and our menstrual periods. If you've ever been pregnant before, we'll talk about the pregnancies, but I'm noticing that no one is talking about menopause. And I greatly appreciate Dr. Durowade because she's been very patient with me. She's listened to all of my concerns and, and she has been there for me every step of the way, her and her staff. And I really appreciate them. And I appreciate the fact that, I feel like the pellet saved my life. Literally saved my life. I really do feel that way. So yes.
Thank you so much. Thank you for sharing that. I really appreciate it. Thank you.